I will now perform the functional assessment, performing hand hygiene and putting on gloves. I will first assess the patient's appearance. Patient's height and weight is normal and appropriate in relation to health, age, and lifestyle. Patient demonstrates appropriate behavior. Patient is relaxed. Patient expresses effective communication, and patient appears to be well groomed. I will now assess the patient's skin by palpating with my fingers and placing my hand on the back of the forehead. Patient's skin color is within normal limits. Patient's skin is warm, dry, intact, and even in pigmentation. I will assess patient's skin turgor by pinching a portion of the skin on the forearm, and patient's skin turgor is within normal limits. I will assess the patient's mucous membranes, removing dentures if appropriate. Patient's mucous membranes are free of lesions or abnormalities. They are moist, pink in color. I will assess the patient's hair and scalp. Patient's hair is blonde in color, free of any lesions or parasites or abnormalities. Patient's hair is smooth in texture. It is even in amount and distribution. I will assess the patient's nails. Patient's nails are pink, normal in size and shape, and smooth. I will now, and nails are dry. I will now assess the patient's neurological system by assessing the patient's pupils first. Patient's pupils are round, reactive to light, and accommodating. I will assess the patient's gait by asking the patient to walk, placing one foot in front of the other, heel to toe. Patient's gait is normal, steady, and balancing bilaterally. Patient's posture is erect. I will now assess the patient's musculoskeletal system. Patient's posture is erect. Patient's gait was assessed in the neurological portion of the assessment. I will assess the patient's range of motion by asking the patient to lift the arms above the head and back down, assessing the patient's tone at this time. Asking the patient to lift the hands bending at the elbows and placing back down, and turning the forearms in and out. Patient's tone and range of motion are within normal limits. I will now assess the patient's cardiovascular system. I have already assessed the heart rate, rhythm, cardiac S1 and S2 cycles, and the central and peripheral pulses, and temperature in the vital sign portion of the physical assessment. I would assess palpating patient's shins for edema. No edema noted. I would check patient's capillary refill. Capillary refill is less than 3. I would then move to assess the patient's respiratory system. The patient's respiratory rate, depth, strength, and effort was assessed in the vital sign portion of the physical assessment. I will now listen to patient's lung sounds. Patient's lung sounds are clear and equal bilaterally. Chest expansion is symmetrical. I would assess patient's airway patency by asking the patient to place one finger occluding one nostril and blowing outward, and asking the patient to do the same on the other side of the nostril. Patient's airway is clear. No cough is noted. Patient's sputum is clear and normal in amount. I would then assess the patient's gastrointestinal system, assessing the patient's abdominal contour. Patient's abdomen is flat and round. I would assess for any nausea or vomiting. No nausea or vomiting is noted. I would assess for fecal consistency and frequency. I would assess for visible or occult blood. Fecal frequency and consistency is within normal limits. No blood, visible or occult, is present. I would assess for an ostomy if applicable. And I would do all of this while the patient is sitting, of course, and then I would assess the patient's bowel sounds while the patient is laying down. Listening to bowel sounds in all 4 quadrants. Bowel sounds in all 4 quadrants are present. No abnormalities are noted. I would then move on to assessing the patient's genitourinary system, assessing urine for color, character, consistency, odor, and amount. I would assess an ostomy if applicable, and I would then assess the external genitalia and the anus for appearance and patency. I would then assess the patient's reproductive system. If the patient was female, I would perform a breast exam, palpating the breast with my fingertips in a circular motion, moving from inward to outward, moving up into the axillary area, noting any nodules, lumps, pain, or tenderness, noting any lesions or abnormalities. If the patient was a male, I would perform a testicular exam, cupping the testicle into the palm of the hand, and palpating between the index finger and the thumb, observing for any nodules, lumps, pain, tenderness, change in size or color, noting for any lesions or abnormalities as well. And this would complete the functional portion of the assessment. I would discard gloves and perform hand hygiene.